Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So today we're going to talk about, is this discoloration or is it not? So discoloration is when you have a dark spot, and it could be due to anything. It could be due to an acne bump that's resolved and left a discoloration on your face. It could be due to a bruise of some sort that again left a discoloration on your skin. Or it could be due to just an increased pigmentation due to sun exposure, or it could be due to you picking at one of those lesions during your acne surgery and you're left with some type of discoloration. Well, my concern is it discoloration due to increased pigmentation, or is it discoloration due to a bruise? And the difference is pigmentation, once the rash has resolved, especially in ethnic skin, it leaves a discoloration behind. And when that happens, you're left with this dark spot that over time you will need some type of bleaching cream, or even time will get rid of that. But if you have discoloration due to a bruise, well, that's different. So a bruise is when you have a acne lesion, and as it resolves, it leaves, again, a discoloration, but is due to hemosiderin. So the difference is hemosiderin is when you're, like I said, you have a bruise, your body absorbs the red blood cells, but it leaves this stain behind. And that's exactly what it is, a stain. And the stain is hemosiderin. The problem is we have no way of getting rid of it. So in Caucasian skin or light-skinned individuals, they would notice a honeycomb type of coloration, whereas in ethnic skin, darker individuals such as myself, we would see a dark spot that looks like, guess what? Discoloration. So you cannot tell the difference for a lot of people. And so you ask yourself what to do. Well, of course, if it's in an area that you don't want to have this discoloration, you're going to try to treat it. You need to try to get rid of it. Again, your bleaching creams, you try those. There's 2%, 4%, or even 6% you can go with. When those do not work, and I always give them 3 to 6 months to work, you can add on chemical peels. Chemical peels does a really good job. I like the glycolic acids, but there's the beta hydroxys out there, salicylic acid containing chemical peels, and you do those as indicated per the manufacturer. But even after doing that, if it goes away perfect, then you're looking at a discoloration, increased pigmentation that's causing your discoloration. However, if it does not budge, does nothing, and you've given it all, you treat it the best way you know how, then you're looking at hemosiderin or iron stain due to an injury that you had at that area that left this discoloration. And at that moment, there's nothing more to do. This is something you would just have to deal with, unfortunately. So my point is, when you're going to get treatment for discoloration, especially if you're paying someone to do the job, seeing an esthetician or you're seeing a doctor, and your doctor's prescribing medications or suggesting things that's not working, or your esthetician is doing all she can, unfortunately, some things are out of their hands. And in this case, it's when you have an iron stain called hemosiderin that appears, like I stated, as a discoloration. That's when it's time to abort, stop, and accept what is. So you ask yourself, why does that happen? So the hemosiderin can occur when, let's say, an acne bump. The bump causes so much swelling that release the red blood cells that seep from out of the blood vessels into the area from the stretching of the skin. And when the acne bump goes away, or after you finish traumatizing the area by doing your acne surgery, your body heals and it absorbs the red blood cells, but it leaves that stain behind. And so unfortunately with acne, you just don't know how much your skin can really tolerate. Again, is it increased pigmentation or is it hemosiderin? And you really don't know until you just really put your best foot forward and try to take care of the discoloration. And after a period of time, 3 to 6 months, if it's not resolved and you've done the bleaching creams, you've done the chemical peels, which is my favorite, then you're looking at accepting that what is. Any questions? Thank you. Thank you for joining me, Dr. Raymond. And yes, and any questions? All righty. Well, thank you again. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So again, if you want to have treatments by virtual dermatology visit, go to yes.I-want-clear-skin.com. yes.I-want-clear-skin.com and sign up there. Take care. Have a wonderful evening. Good night.